My name is Sarah Hobart, and I'm a sports specialist with Towson Orthopaedic Associates. I got interested in orthopedics when I suffered an ACL injury myself while I was in high school. I came to really admire my surgeon, and he became a mentor as I went through college, medical school, my residency. So it was my own experience as a patient that really introduced me to the specialty of orthopedics. I think in orthopedics you can really make somebody a lot better and improve their quality of life. And it's really fun to watch somebody from the beginning of their injury or having an exacerbation of their arthritis and seeing them through till they recover or are feeling a lot better. I think one of the things that makes my practice unique is that I see patients of all ages, from infants and toddlers that perhaps have a fracture, to folks that are in their teenage or pediatric years where they have an ACL tear or a growth plate injury, to patients who are in their 30s or 40s who perhaps have a fracture as well, or have a tendonitis or an overuse injury, to folks that have perhaps arthritis in their 50s or 60s, to folks who are in their 80s and 90s who perhaps have a hip fracture. So I think that seeing people from their very beginning of life to perhaps some of their older years is something that makes my practice unique. I think our team is exceptional because we take a lot of care in who we are bringing on our team, whether it be their experience, whether it be how they treat other people. I think that it's important for us to be good listeners in order to be good care providers. And I think that that's something that sets us apart from a lot of other practices. Given my own experiences as an athlete, as an adolescent athlete, as a high school athlete, as a Division I college athlete, I have experienced injury myself. I did tear my ACL when I was in high school, but was still able to recover and play Division I soccer. And then later on in life, over 20 years later, I tore my ACL again when I was in my late 30s. I think that has given me a unique perspective as well as empathy with my patients who have these injuries, whether they are in their adolescent or teenage years or in their 30s or 40s. I understand that a lot of these injuries, especially as a child, can be life-changing.